This is Jake, a 32-year-old male. He is getting more and more worried about his job performance. Although he is financially secure, he is increasingly worried that he is going to lose his wealth due to unexpected expenses. He often felt tense and irritable while he is at work and spends time with his family. He's having difficulty distracting himself from worries about the upcoming challenges for the next day. He reported feeling increasingly restless, especially at night when his worries kept him from falling asleep. Is it normal or pathologic? Let's talk about it. Anxiety is a normal human behavior that involves apprehension, tension, or even terror, which serves as an adaptive mechanism to warn about external threat. It is caused by the activation of sympathetic nervous system. Anxiety becomes pathologic when fear is greatly out of proportion to the risk of threat. It may also impair social and occupational functioning. Often it may comorbid with substance use and depression. Anxiety disorder is characterized by excessive, persistent, and unreasonable anxiety about everyday things like family, work, relationships. There is a diagnostic criteria for generalized anxiety disorder according to DSM-5, and excessive anxiety and worry occurring more days than not for at least 6 months about a number of events or activities. The individual finds it difficult to control the worry. The anxiety and worry are associated with three or more of the following six symptoms, which are restlessness, sleep disturbance, irritability, difficulty concentrating, fatigue, and muscle tension. Anxiety causes significant distress in social, occupational, or other important areas of functioning. The disturbance is not attributable to the effects of substance or another medical condition. The disturbance is not better explained by another mental disorder. Causes of anxiety are not known, but data suggests that it is a combination of environmental factors and genetics. It runs in the family and it is more prevalent in females. Treatment of generalized anxiety disorder include lifestyle modification, such as to avoid caffeine and alcohol and to take care of the sleep hygiene. Psychological therapy is cognitive behavior therapy, relaxation techniques, and mindfulness. Biological treatment include SSRIs and SNRIs. Panic attack is a type of anxiety disorder where someone has physical symptoms along with anxiety, and sometimes these physical symptoms do resemble serious health conditions such as myocardial infarction. But in real, the person is going through panic attack. So let's see what is the diagnostic criteria for panic attack. The diagnostic criteria for panic disorder include four or more of the following symptoms: palpitations, sweating, trembling, sensation of shortness of breath, feeling of choking, chest pain or discomfort, nausea or abdominal distress, feeling dizzy, unsteady, chills or heat sensations, paresthesia, derealization, depersonalization, fear of losing control or going crazy, fear of dying, 1 month or more of anxiety about panic attack, meaning persistent concern or worry about additional panic attacks or their consequences. The disturbance is not attributable to the psychological effects of a substance or another medical condition. The disturbance is not better explained by another mental disorder. Treatment of panic attack includes psychological therapy, which is cognitive behavior therapy. They give interoceptive exposure. Pharmacological therapy is SSRI and SNRIs. The difference between panic attack and panic disorder is panic attack is a single episode of combination of signs and symptoms which are discussed earlier in the diagnostic criteria, and it can occur in the context of many different disorders, whereas panic disorder requires recurrent, unexpected panic attacks along with the fear of having another panic attack. Obsessive compulsive disorder is a kind of anxiety where someone has repeated thoughts of doing something, and if the person is unable to perform that act, there is anxiety. This is a person who is late every single day at work because he feels a need to check his door lock several times before he leaves. There is a diagnostic criteria for OCD. Obsessions are recurrent and persistent thoughts, urges, or images that are experienced and cause marked anxiety or distress in most individuals. Compulsions are repetitive behaviors or mental acts that the individual feels driven to perform in response to an obsession. It causes significant distress or impairment in social, occupational, or other important areas of functioning. The symptoms are not attributable to the effects of a substance or another medical condition. The disturbance is not better explained by the symptoms of another mental disorder. Treatment of OCD is either psychotherapy, which is cognitive behavior therapy. ERP is exposure with response prevention. It involves exposure to feared situations with the addition of preventing the compulsive behaviors. Pharmacological therapy is SSRI or SNRIs for 12 to 16 weeks trial. High doses are advisable for OCD as compared to depression. Back to the case which we have discussed earlier. Jake is having excessive worries about different things, and he's having distress in social and occupational area of functioning. Therefore, it is generalized anxiety disorder. Thanks for watching.